Joining us. Welcome, welcome. If you'd like to, you can let us know where you're tuning in from today in the chat and maybe what you hope to learn. And just know that we welcome your questions at any time, so please feel free to put those in the chat. Welcome to Beyond Traditional Care, utilizing unconventional mental health resources. My name is Lisa Meekum. I'm a volunteer with Families for Depression Awareness, and I'll be moderating today's panel. I'm a person with lived experience of depression and have also been a caregiver for others experiencing depression and bipolar disorder. We're so glad to have you here with us. To those of you joining live and those of you watching the replay of the video later, when we talk about traditional mental health resources, we may be talking about different therapeutic modalities, psychiatric care, inpatient and outpatient care, but it's our hope today that you may come away with more unconventional resources for your toolkit for mental wellness. I'm going to tell you a little bit about how our program will go, our agenda for today. In a minute, I'm going to introduce our panelists. Like I said, we encourage you to share your questions or comments in the chat throughout the discussion, and we will weave in your questions when we can. This program is being recorded and will be available to watch immediately after it airs. And we'd like to remind you that we're doing a survey at the end to evaluate our program. So if you can stick around after the presentation, please do fill out the survey so that we can improve our programs in the future. I would love to tell you a little bit about Families for Depression Awareness. Our mission is to help families recognize and cope with depression and bipolar disorder, to get people well, and to prevent suicides. Our philosophy is that when a person is living with depression or bipolar disorder, it's the people around them. It's the parents, the siblings, the grandparents, the friends, all of those people in their lives that have a strong and powerful position to support that loved one. Yet caregivers don't always know what to do. And that's where Families for Depression Awareness comes in. We provide education, training, and support specifically geared towards family caregivers so that they can be a strong advocate for their loved ones and a partner in their care. The hub of our resources is at our website, which you can see here is familyaware.org. Some of you may have already visited it, but if you've not yet had the chance, please do. You'll see that we have web tools, other webinars and workshops that we've had in the past. We've got educational live streams, a toolkit and action plan and publications, depression and bipolar screening tools. We also have a mental health family tree tool, just loads of resources that are very, very helpful. And we encourage you to visit the website. Before we launch into our program, we'd like to thank our funders that have made all of this programming possible. The Takeda Lundberg Alliance, AbbVie, Johnson & Johnson Innovative Medicine, the Massachusetts Department of Public Health Suicide Prevention Program, our corporate members, Sage Therapeutics and Biogen, Takeda, Alkermes, Johnson & Johnson, and Neurocrine Biosciences. And then, of course, people just like you, people who donate to us, who believe in our mission, who believe in our cause. We really appreciate everyone's support. I would like to go ahead and introduce our wonderful panelists for today. Charisse Danielle Rupert is a native of Jackson, Alabama. She's the mother of 5 children, the grateful grandmother of 2 boys and a newlywed. She is an Alabama certified peer support specialist, certified recovery support specialist, CPS state trainer, APPR facilitator, a NAMI IOOV and Connections support group facilitator, as well as a Respect Initiative of Alabama speaker. Charisse was previously employed as the Youth Peer Program Team Leader, Youth Peer Program Coordinator, and Adult Peer Services Team Leader for JBS Mental Health Authority. She is currently serving her 2nd term as chair of the Alabama Disabilities Advocacy Program. Protection and Advocacy for Individuals with Mental Illness Advisory Council. In addition, she was recently appointed to the Supreme Court of Alabama's Commission on Adult Guardianships and Conservatorships and the NAMI Alabama Board of Directors. Her mantra is "Recovery is possible, I am proof." In her previous role as director of the Alabama Warm Line and in her current role as executive director of Wings Across Alabama, she continues to focus on the importance of supporting the supporters. Welcome, Therese. Sarah D'Souza Brown is a program officer at Clubhouse International with over a decade of experience in the Clubhouse model of psychosocial rehabilitation. Previously, she worked at Genesis Club in Massachusetts, one of the 12 Clubhouse International Training Centers. Sarah is passionate about advancing the mission of ending social and economic isolation for people with mental illness by enhancing the growth and quality of Clubhouse programs worldwide. Sarah is originally from Brazil and has been living in Massachusetts since she moved there with her family in 1995. She enjoys the opportunity to travel and immerse herself into new cultures, and especially treasures trips to Brazil to visit her family. Sarah is the mom of a toddler and the dog mom of a Shih Tzu named Charlie Brown. Together with their husband, they look forward to warmer New England days and enjoying the outdoors together. Welcome, Sarah. And Sumitra Polkato is a project associate for the SOAR Center within the Substance Abuse and Mental Health Services Administration. Prior to joining, she worked as rehabilitation practitioner, where she was responsible for providing recovery-oriented services to individuals of the serious and persistent mental illness population. It was in that role where she first became introduced to SOAR and proudly served as a SOAR-trained case manager and SOAR local lead, helping to raise the approval rates and number of SOAR-trained case managers in the 5 counties she served. In addition to her professional human services experience, she is a licensed mental health counselor in New York State and a certified peer specialist. Welcome, Sumitra. Thank you so much for joining us, everyone, today. I'm going to go ahead and ask everyone some individual questions, and then we'll do some group discussion. And as always, if you're joining in, please feel free to drop any questions or comments into the chat. So Sarah, we're going to start with you about Clubhouse International. Can you explain the Clubhouse model and how it differs from traditional mental health support systems?
Hi, everyone. Thank you for the introduction, Lisa. It's an honor and pleasure being here with this panel today. So very quickly, like Lisa said, I work for the organization called Clubhouse International, and we are the only nonprofit global organization that helps to start, grow, and ensure the quality of clubhouses globally. All clubhouses are based on the Clubhouse model of psychosocial rehabilitation, which is a rights-based approach to recovery. And we have the vision that of a world where people with mental illness recover and are an integral part of our society. So that's a little bit about Clubhouse International. We are responsible for coordinating expansion, accreditation, training, public awareness, advocacy, and research. But I think what brings most of you here today is what is a clubhouse and how do I find a clubhouse? And so what really makes the Clubhouse model different from other traditional mental health services, a few different things. We are very intentionally a non-clinical program. We know very well and understand that clinical mental health services have their rightful place in the lives and in the recovery of many members who come to the Clubhouse. But we are intentionally different from that because those needs are met elsewhere. The Clubhouse provides opportunities for employment, education, wellness, housing, friendships. What also sets us apart a little bit is what we call the work-ordered day. Our recovery model for people living with mental illness is really to come to a place where you are needed, wanted, expected, and welcomed for your skills, talents, your abilities, what you can bring. It's not a place that's, looking to, not that we don't care, but the primary thing is not what is your illness and what makes you so sick, but it really is, what can you bring to this community? What can you do to help us make this community even stronger? And so from cooking lunch to writing grants to collecting and entering data, gardening, planning the social program, basic maintenance of the building. All of the work that it takes to run the clubhouse is done in partnership between staff and members. And we are very uniquely, intentionally understaffed so that members, so there's a real genuine need for members to come in and again, bring those skills, talents, and abilities to create a strong and functioning clubhouse program. We are not a peer-run organization as some other models are. We're a partnership model. So again, we're really built on the premise that members and staff can truly work together in all of the important operations of the clubhouse. So like I said, from writing a grant to cleaning the bathrooms together, all of that is done between members and staff. And so some of those are the few things that I think makes us a little unique.
Wow, that is really, really interesting. What are some of the key benefits that members experience from participating in a clubhouse community? You touched on that a little bit, but some more concrete examples.
Sure. So clubhouse communities are voluntary communities. Members can choose to come when they want to come, stay as long as they want to stay. Choice is vital to recovery. So the clubhouse is designed so that any we call units or departments, the clubhouse is structured into these different departments where the work is organized. And any unit that a member walks into, you can see what needs to be done and you can make choices based on what the clubhouse has to offer. So that, for a lot of folks living with mental illness may have had the experience of having their choices taken away, in some more intensive clinical mental health treatment or inpatient treatment where, folks are told you have to go here at this time and this is when group therapy starts or this is when you take your meds. And so we are very intentionally designing a space where members come in and choice is like one of the key elements to recovery. But some of the things that members have access to and some of the benefits of membership in clubhouse communities is access to an employment program, which is a critical part of the clubhouse approach to recovery. We have this different tiered system of employment supports from transitional employment to supported employment to independent employment. And without going into too much detail about each one of those, the key thing is that members can get supports and employment at the level that they want to receive those supports. So from placing a member on a job and training them on a job and working them side by side on a job, those supports are available all the way to the other end of the spectrum, which might be, hey, look, I just need to write my resume, or I just need to, do an interview practice, and then off a member goes to get their own independent jobs. And everything in between, the clubhouse provides supports from those things. The clubhouse provides guarantees to a place to come, to engage in meaningful work, to build meaningful relationships, and a place to always return to. And some of the benefits that members have experienced by participating in Clubhouse is higher rates of employment, decreased hospitalizations, reduced incarcerations for people involved with the criminal justice system, better physical and mental health, and it's a very cost-effective model. So those are some of the examples.
Wow. And for caregivers, watching this, how will they help their loved ones support to clubhouses?
So we support and help to coordinate 368 clubhouses in 33 countries. A large majority of these clubhouses, 246, are in the United States. So you can learn more about a clubhouse near you by visiting our website. This information will be put out to you, but it's clubhouse-intl.org. When you go on our website, there's a feature that's called Find a Clubhouse. You can click there and you can locate clubhouses by country, by state, or by city. And clubhouses should have links to their own websites, and then you can click on there, learn more about each individual clubhouse program. Each clubhouse might have a slightly different enrollment process. It's not necessarily exactly the same across the board. So we would just recommend call your local clubhouse, inquire about how do I get a tour. We highly encourage you to, take that first tour for yourself or for you and your loved one to really see if this is something that, is this going to be a good fit? Do we see ourselves getting connected with this program. And you don't have to make that decision before the tour. You can come in for the tour and then inquire about the enrollment process, which is generally very easy and very quick.
Sarah, thank you so much. And for those of you who are here live, we've dropped those resources into the chat, and they will also be available on the website familyaware.org after the presentation. Thank you so much, Sarah. Charisse, why don't you tell us a little bit about warm lines and how they differ from traditional crisis hotlines?
Yes, good afternoon, everyone. I'm honored to be here. So warm lines differ from traditional hotlines in that they provide support either pre-crisis or when there's not a crisis. So where you would typically call a hotline when there's an emergency, warm lines are available for anyone who just needs a warm, empathetic listening ear that may not rise to the level of a traditional crisis. As a person myself who's a peer, and just to share about that real quick, peer specialists are individuals who have themselves experienced mental health challenges and who throughout their journey found it beneficial. And so we go back to support other individuals who are also starting their mental wellness journey. And so for someone who's calling a warm line, for them, it may be a crisis. It may feel like a crisis. And so if they call 911 or 988, they may refer them back to us at the warm line where we can just listen. It's all about support. That's really the key with everything that we do with peer support is to support the individual. So again, similar to what Sarah was sharing, we're not trying to change them. We're embracing them, accepting them the way that they are, allowing them to share their feelings. And for a lot of individuals, when they do contact a warm line, it may be the first time that they actually have been heard and felt heard and were able to share how they were feeling without being judged or just feeling that freedom of sharing with someone who, when they share, can say back to them, I've dealt with something similar. You're not alone.
Wow, that's very, very powerful. Would you like to share some success stories that you've had, your organization's had with the warm line, maybe both from caregivers or people with lived experience?
Yes. So this one is more so for caregivers. So we had a caller who she called for 2, 3 years, multiple times each day. She was living with a terminal illness and she did not want to burden her family with her feelings or her fears or her depression, and so she would call the warm line, and in her mind that was a way for her to be able to share and get those things out without being an extra burden she felt on her family members, her caregivers. And so that was a very interesting caller. Because again, she would call multiple times each day. There wasn't any limit on her being able to contact us more than one time. But again, even when she got to a place where she was in so much pain, she was bedridden, she couldn't really go outside, she couldn't really interact with anyone else. She had the warm line, and we were able to provide her with a lot of support and really friendship as well. Another example, and this one is really dear to my heart. We had a caller that called for years, and over the last 6 months of her calling, there were some concerns. So we had one of our warm line specialists who expressed some concerns, and then another, and we were trying to figure out what can we do to assist her. Now, this isn't something we typically do, but there was a major concern. So I reached out to a mental health agency in her area, and amazingly, the individual that called me back was familiar with this caller and proceeded to let me know something that we didn't know, which was that they tried to go and assist her a year before and were not able to enter her apartment. And so we worked with them closely, where we coordinated having one of our warm line specialists actually call her on the phone, let her know that they were outside her door what they were there for, and we were able to help facilitate her getting the support that she needed. And that really blew my mind. We were just like, wow. But those are just two examples of how people have been impacted by being able to have a safe space to call, somewhere where they feel understood and heard. And also, I'll share this. When I began working with the Warm Line, I kind of had this idea in my head that it was people who were all alone that were calling. But no, we get calls from across the country, individuals who call on their lunch breaks, who just need someone to share with. And it's just really been amazing being a part of this amazing, the Warm Line community itself.
Wow. And I think something that's important, and you can correct me if I'm wrong, but both caregivers and people with lived experience can call Warm Lines for support, correct?
Yes,
Yeah.
yes. Anybody who needs a warm, empathetic listening ear can call.
Wow. So how would people access Warm Lines? And again, we'll drop these in the chat as you mentioned them, but let us know.
Okay. So currently there are around 100 warm lines throughout the country. There's a warm line directory, which that link is in the chat. And in addition to that, I actually am the executive director for Wings Across Alabama. We are the largest mental health peer-run nonprofit in Alabama, and we operate the Alabama Warm Line. We accept calls from across the country. We're open 24/7. In addition to the services provided through the Warm Line, we also have 3 other flagship programs that we offer. All of these are free. They all support mental health wellness and recovery, and they give individuals the freedom, where, with traditional support, you may have to make an appointment, or you may not want to go. Your family or caregivers may want you to go. You're unsure. Well, with the services that we provide in other peer-run organizations, we give individuals that freedom back. That's the core of what peer support is about, what that individual wants for themselves. So through the Warm Line, where individuals can call 24/7, or our education program, which is APPR, Action Planning for Prevention and Recovery. We offer those trainings to anyone throughout the country for free, in addition to support groups that we offer in person here in Alabama, as well as many support groups online as well. All of these are here to support individuals, their caregivers, their family members, or anyone who has a desire to learn more so that they can be a support within their own community. So you feel free to reach out to me with any additional questions. But we are here to support not only Alabama, but the nation.
That's so great. We've got a quick question here that I can have you directly answer. Do the same people tend to call Warm Lines frequently? Is there a time limit that people should be aware of when they call?
Half and half. That we have our regulars that do call frequently, but we also have individuals who may be dealing with an isolated situation or feeling a certain type of way and may not want to share with their best friend, out of fear of being judged. And they may call, just once or twice. Also, we do have call limits in place now because we've experienced a major increase in call volume. June 2022, we began operating 24/7 after being open only 40 hours a week. Right now, we average around 44,000 call minutes per month. And because of that major increase, we have had to limit the calls to 15 minutes, 15 to 25, depending on if they're in state or out of state.
Wow, thank you. Thank you so much. And Sumitra, welcome. Let us know how can applying for disability benefits support a person's depression treatment and overall wellness?
Yes, that's a great question. I just want to say hi all that are joining us, and thank you for having me because I really love talking about this topic. So I think, as you know, especially as my co-presenters have mentioned as they were talking, right, when we're thinking about individuals living with depression and other mental health conditions, right, and we're thinking about, recovery, right? And how we manage that. There are so many different kind of multiple pathways to be able to do that, right? There are so many things that if we address them, that they can help overall with that recovery. And financial wellness and empowerment is absolutely one of those. We know that recovery is individualized for everybody, but anyone who's listening or watching or joining this call, I challenge you to pause for a second and think about either yourself or your loved ones or individuals you've supported, and think about the different kind of recovery goals they've had. And I challenge you to find at least one goal that having access to income doesn't make easier to achieve, right? I mean, I seriously challenge you to think about it, whether it's, looking to find or maintain or afford housing, whether it's to be able to get out into your community more and engage, whether it's to get a girlfriend or a boyfriend, right? Like having access to income helps to facilitate those goals so much easier, right? It facilitates an easier pathway to those goals. And when we think about income, there's, again, multiple different pathways or whatnot that somebody, can try to increase that, whether it's through employment or whether it's through other sources such as disability programs. And there's many different types of disability programs. The one that I'm focused on and that my work has been on is looking at Social Security disability programs and how we help to streamline and make that process easier to navigate for individuals with severe mental health conditions and or that are experiencing homelessness. I think to get to the point of your question, Lisa, in terms of thinking about, well, how does, applying for disability benefits, how would that, might help someone who's experiencing or living with depression? I think that there are a number of important things to, if somebody's considering or thinking about applying, right? I think the important thing to really think about is how looking at obtaining access to a federal benefit such as Social Security disability can kind of help serve as a base from which that person can then grow and continue to work on whatever recovery goals they might have. And I think especially just kind of looking at your local community in which you live, and I'll just give you some couple examples. If you live in a state or community where there isn't necessarily easy access to Medicaid or health insurance, if you're in a non-expansion state, looking at how connection to disability benefits, if somebody's approved, they are automatically entitled to either Medicare or Medicaid, and ideally being able to access greater treatment if that's a pathway that person was looking for. So having greater access to health insurance. I think looking at, having that security, that safety net of income, right? Do you know what I mean? In terms of being able, if the person wanted to explore employment or saving for education, having a sense of comfort and bravery to do that because you know that you have this income safety net, right? And again, I think just overall looking at how like financial wellness, because I think sometimes when we think about the different contributing factors to health and wellness, I think sometimes like we forget about like financial security, right? And income and like how that impacts our well-being, right? So I don't want to ramble, but I think just thinking about how that intersects together.
No, that's so critical. And I think you're right. And too often, I think the financial piece ends up in a crisis state, and then you're trying to manage that on top of everything else. So the safety net piece is so important. I know, from personal experience, it can be overwhelming to apply for things. Do you have any advice for people who are looking to apply for these types of supportive programs?
Yeah, absolutely. I think the important thing to note is that there are supports out there to be able to assist with doing that. I think that because sometimes it can be hard to navigate or find those sources because it really does look differently depending on your state or even in the same state, the community that you live in. So in terms of becoming familiar with what those resources and sources are, I would say if you are supporting someone living with depression, or if you yourself are experiencing depression and you're like, I think maybe, applying for disability benefits might be a pathway I want to explore. The first thing I encourage you to do is you can reach out to what's called your local continuum of care. And oftentimes they coordinate services for, their community, and they would likely be able to let you know whom are the local, agencies that are assisting with that service. Another thing I'm going to encourage, and we'll put the link in the chat box, the program that I specifically represent, SOAR, which again trains caseworkers or whoever helpers are to be able to make this process a little bit easier to navigate and more mainstream. We'll put a link in the chat box where you can find out who are the active SOAR providers in your community within your state. The only caveat that I would mention is that for many of them, they do have a focus on assisting those that are experiencing homelessness or are at imminent risk of homelessness. which can include somebody who's living in a transitional setting like a hospital or a jail, or living couch surfing, or living doubled up. It does include those as well. But if you're looking to kind of see who the active SOAR workers are, or SOAR agencies are in your community, you can click that link to find out more. And aside from that too, I encourage you to think about kind of like non-traditional sources as well. I think sometimes people forget about different centers for independent living who do great work with helping people apply for disability benefits. But I think overall, the main connector is really kind of reaching out to your continuum of care to become familiar with who are the agencies that provide, assistance with just kind of navigating the system in general.
That's incredibly helpful. I guess for all of us, stigma is something that we're always contending with. And certainly, I think there's another layer of stigma when it comes to supportive programs like this. So do you have any words of advice for people that might be holding them back from wanting to move forward in applying or looking into these types of programs?
Yeah, that's a really great question, Lisa. And I think that it's really important, because I think that stigma and fear, well, at least from the work that I've done professionally, it seems like that stigma and fear has been one of the biggest barriers in terms of people being able, wanting or choosing to access connection to disability benefits as a tool for their own wellness. And I think, all of us in this audience probably either live with or support someone with mental health conditions. So we probably can relate 100% or know what that feels like, right? And oftentimes when we are living with a mental health condition, our self-confidence already takes a beating. And then if you have somebody mention like, well, maybe you should apply for disability benefits, it's only natural to kind of think or assume, well, I have this mental health condition, I just have to apply for disability benefits. There's nothing else I can do. I can't work. I can't have friends. I can't go out in my community. I can't do these other things, right? So like just kind of there's like that assumption, but then there's also this stigma that others place on us for that, even if it's not us placing that on ourselves. But I'm here to kind of serve as a myth buster, because a lot of those things are myths. And what I encourage you all to really consider, right? Two things to consider. So one, when I'm talking about connecting, and encouraging people to consider disability benefits access as a tool for wellness, I'm not coming from the position of anyone who's diagnosed with a mental health condition should apply for disability, because we all know that simply living with a mental health diagnosis does not mean that we cannot work. It does not mean that we cannot, live fulfilling lives. It does not mean that. But for those of us, or for people that we're supporting who live with these mental health conditions, and those conditions have led to severe impairments in our lives, which make us, unable to work at a level where we can sustain ourselves, then access to disability benefits may be a tool. And what we can do to help support is to really kind of be myth busters in that, hey, if you are thinking about applying for disability, this doesn't have to be the end all be all of your life. Think of it as literally like the base of a house that you can then grow from and do other things, because you now have this safety net. You are addressing this piece of your health and wellness. You're addressing this financial wellness piece, and that you can feel safe and secure knowing that you have this safety net, and that you can try out work and not have to worry about not having a paycheck if you can't keep that job. You can put some of that money aside for saving for educational expenses to go to school, right? Or to try out other vocational things, right? You can, have that money to put forth to be able to maintain a housing, right? So that piece of your wellness is taken care of, right? So I don't want to ramble, but I guess just like, I really encourage you, you all to just kind of be myth busters, because I think oftentimes people are scared because they think that it's, once you're on it, you just have to stay on it. And it's just not true. There are just so many incentives to try out work and education, and that it is truly something to be a tool to be able to help somebody achieve whatever kind of recovery goals that they may have, and whatever their definition of a fulfilled life is, right? So it is a tool. It's a base. So we are here to be myth busters. It is not a self-fulfilling prophecy. It is not the end all be all of your life. It is a tool.
I'm over here snapping because that's so important. And I think, yeah, all of these resources you all have shared today are just pieces of the puzzle, so that whatever, we're not all the same, and there's a spectrum, and whatever level of support you need, there's something out there that might be right for you, which is why especially these non-traditional resources are really, really important. So we're going to move on and I'm going to ask questions. Whoever wants to answer can. We may have a brief pause while we wait and see who wants to answer, but please, if any of you or all of you have something to to respond to, please do. So the first question is, what advice would you give to family members or friends? So again, this idea of the caregivers who want to support a loved one exploring alternative mental health resources.
I can start.
Great.
Yeah, so I think, I think there are a number of ways, of course, that they can support. But I think that one of the biggest ways, or at least something that was helpful for me as a person with lived experience, is having someone who is just there to listen. Like someone who's just there to listen. We are the experts in our own lives, even when sometimes it seems like things are a little chaotic or are in turmoil. So I think that as someone who's supporting someone living with a mental health condition, is really just being there, listening to understand and not listening to just respond, can be incredibly helpful, especially when we're talking about non-traditional methods, right, of wellness and recovery. And just specifically to like the disability piece, I think that aside from being a myth buster, a really important way that caregivers can assist people that are thinking about applying for disability is sometimes they might need your help to kind of remember, aspects of their life or previous treatment or information that might be helpful for the disability examiner to understand how their conditions are impacting their life. And so you can be really helpful in terms of that process with, joining them on their different telephone calls or interview, helping to provide that background info. Somebody might be coming to you saying, "Mom, do you remember where it was that when I was, in treatment a couple of years ago? Can you help me get those records?" So I think really just kind of making yourself available during that process and kind of helping to fill in the gaps if that's needed.
I would just add to Lisa, I think that sometimes just that mindset change to, from I'm too scared to get help or I don't want to reach out to anybody, and switching to, okay, I think there's somebody I need to reach out to. I think sometimes that's the hardest part. And that first phone call to, a clubhouse or to a warm line or to that, disability benefit specialist or whatever, sometimes that very first call feels like the most daunting thing to have to do. And it's, I think my advice and even personal experience is that it's not that bad. If you can get over that hump of, oh my gosh, this is going to be the hardest thing I've ever had to do in my life, to, oh wait, wow, look at these people on the other side of the call are, they're great people. They're easy to talk to. I hope you're feeling that way about the three of us on this call. It doesn't feel so scary anymore. And so I think for caregivers to, I think, have that patience too, because I think in my experience of working with members over many years at Genesis Club, if people don't want to be somewhere, if they don't want to be at the clubhouse, for example, I think it's going to be much harder to get to a place where they're saying, okay, now I'm ready to work on my goals, whether it's employment or education or wellness or independent living or whatever it might be. So, having patience for folks to get there on their own, and trust that the services that they're working with have their best interest in mind, and that we really are here to support mutual goals, not just the individual who's coming in, but there's goals that extend out to the family and the caregivers, and everybody benefits when the individual is benefiting from the services. So.
Yes, and I would just add, in addition to everything that's already been shared, for the caregivers to have support as well. So in many states, there are parent peers. So those are individuals who have supported their family members through their mental health journey, and they can then provide that support to caregivers who are entering that journey or trying to learn more about it. In addition to that, I also think educating yourself about what's available to support the person that you're providing care for. So looking online, getting more information about services that are provided by Wings, for example, Wings Across Alabama, for example, but becoming more familiar with what's out there, digging a little bit, and just so when you go to your loved one, you can share with them and let them know what you found and give them the opportunity to kind of see if it's something they would be interested in. But there's tons of resources out there. Becoming more familiar with those, I think, is key as well.
Yeah, I think just from the experience of being a caregiver myself, we have a tendency sometimes to want to fix things or make it right or find the perfect situation to help. but just listening, being a safe space for people to have the dignity of their own experience, and understanding that in all of these examples we've provided today, there's a tremendous sense of agency on behalf of the people who are using these services. So that makes a lot of sense. Thank you all for those answers. Is there ever a time that your resource is not a good fit or not appropriate for someone? And what should caregivers keep in mind in those situations? Therese, since you're unmuted, do you want to start?
Yes, I will. The only time I would say would be when there is an imminent crisis, when someone may be having suicidal ideations, and that may be a time where it may be more appropriate to reach out to 988. But even in that, when we do get those types of calls, we try our best to do a warm handoff or at least support them through that. And a lot of times we end up getting calls back days or weeks after thanking us for making that connection. But I think when there's a crisis that needs more than the support we can provide, that's a time where a warm line may not be feasible.
I would say, Lisa, for clubhouses, generally clubhouses are they have different budgets, but generally it's predominantly made up of government funding or sometimes independent fundraising that covers the cost of membership. So that means it's free for a person to join, but that usually comes with strings from the funder. So, you know, for example, most clubhouses do require a diagnosis of a mental health condition or a history of a diagnosed mental health condition. So that paperwork, if somebody's wants to join a clubhouse, doesn't have, you know, an active therapist or case worker or something who can verify the mental health condition, it is something that clubhouses will often step in and help you make that connection so that you can get the appropriate referral to join. So there, you know, it's not really that there's a time when it's inappropriate, but it's more that the history of the mental health condition. So that could be an anxiety disorder, depression, bipolar, schizophrenia. Those have to be the primary diagnosis. And sometimes there are folks that come in with a dual diagnosis, for, you know, for example, a substance abuse or use disorder or developmental disability or other disabilities as well. But again, the clubhouse is designed really to address the primary diagnosis of mental health condition. And so while it might be a place for folks with dual diagnoses, it may not be for everybody. It really just depends on what the specific supports that they're looking for are.
And I would just say, so just in terms of disability in general, I just want to reiterate that, you know, Social Security disability programs are a little bit different than other disability programs like the VA or state short-term disability programs, because a lot of those disability programs will look at like partial disability or will look at if someone's temporarily disabled. For Social Security disability, they look at what they consider only to be like chronic conditions, and it's kind of like an all or nothing thing for them. They don't look at partial. It's like either you meet their definition, either you meet like their criteria for whatever you're alleging, or you don't. And so I just want to kind of remind and reiterate that simply having a diagnosis, that by itself isn't necessarily enough to qualify for disability, because we know that that doesn't mean a person can't work. And the reason why someone would be approved for disability is because their impairments are so severe, it limits their ability to work. So again, if you and your loved one are considering using this as a tool, really, I encourage you to don't come from it from the perspective of, well, you have this diagnosis, this diagnosis, this diagnosis. That's not what they're looking for. Come at it from the perspective of, okay, what is the impairment that this condition is causing you? What is it that you can't do? And is it severe enough that it limits your ability to work? And if so, then maybe this might be something that might be a tool for your loved one.
That makes sense. That makes sense. Thank you. We have a question in the chat, Sarah, that I think you can directly answer. Is there a protocol at a clubhouse if my loved one has a crisis during their time there?
That's something that I think is going to be individual to each clubhouse. You know, again, the clubhouse itself is not a clinical service, but the members come from all walks of life, you know, and so somebody might be experience a time in their life where they really need some more emergent needs or supports. And so Clubhouses, I'll just give you a couple of examples of supports that Clubhouses have provided. We don't try to be the clinical support because we're not. But something I've done personally, you know, a member has come up to me and has talked about, you know, they're not feeling safe, they're not feeling well at home, they're scared to go home at the end of that day. And so my conversation was, you know, so do you feel like you need some emergency mental health services? The answer was yes. Get in my car with me, we'll take the drive over, we'll figure out if this is what you need to do for the night or for the day or whatever. You know, make a plan to call a family member. Do you have somebody that you can count on and you can trust? Those kinds of things. And so we help members make those plans. Sometimes in advance of a crisis situation arising, we think through, you know, if this were to come up, what's your plan for, you know, being well overnight? Because we are not a residential program, we're not open 24 hours a day. And so members generally come, you know, it's generally open around 9 to 5-ish. We mirror the typical working hours where members come to make their contributions. And so what happens outside of those hours are really important to us too. And so we want to make sure members have those connections. I hope that answers the question. I don't, you know, it's not super uncommon for a member to experience a crisis situation because we know recovery is not linear and, you know, there are ups and downs. And so the Clubhouse is a place that kind of embraces all of that, kind of come as you are and let's help you. If we are not the service that you need right now, let's help you connect to that service somewhere else in the community.
That's great. Thank you. Well, before we wrap up, we've all, you know, shared the resources. And again, this video will be available in perpetuity on the familyaware.org website. So for those of you who couldn't join live or those of you who are here live and would like to rewatch it, it'll be available on the website along with all of the resources that you guys shared in the links. Is there anything else we didn't cover that you'd like to share about these sort of unconventional, non-traditional mental health resources, or what caregivers or people experiencing mental illness can look for?
I would just like to share that in addition to the resources that that I've shared, that it also gives an individual access to and welcomes them into the peer community, which is a place where they can constantly, whether they're in crisis, not in crisis, receive that support, realize that they're not alone, be surrounded by individuals who are also on their recovery journeys. And it just makes a world of difference in someone's life to even have a community like that to be a part of. So it's not just this resource or that resource, it's welcoming them into the peer community.
Thank you.
I want to add to Lisa that, you know, I shared the number of total clubhouses around the world and in the United States, and it's kind of a striking number. But there are states that don't have a clubhouse at all. There are states that have 30, there are states that have 5. And, you know, for families or people living with depression who do not have a clubhouse near you and you want to bring a clubhouse to your region, reach out to us because we do a lot of the, we offer a new clubhouse development training for groups that want to start a clubhouse. And so we do a lot of those technical assistance to get clubhouses off the ground. So please don't hesitate to reach out. And if there's some interest in your community, we can help bring folks together, the right folks together who can help make something like this happen.
Well, that's so great. And Sumitra, I think I actually have a question here for you that you can, you know, incorporate into your final answer. But what would you say to families that are intimidated by the process of helping someone go through the long process of getting on disability for a mental health condition?
Yeah, that's actually a great question. And, you know, the system itself, or I should say like the process itself can be, or at least seem really intimidating and long. And that's because it can be complex. And especially if you don't really have any kind of prior knowledge or personal lived experience of going through it. But what I would say to families that might be feeling that way is that please know that the supports are out there. I think for a lot of us, we just don't know where they are or who they are. But I really encourage you all. So the link that I had mentioned earlier about finding like a SOAR caseworker, I encourage you all, like if you have well, first and foremost, if anyone has general questions about the disability application process, they can reach out to me via email and I would be glad to answer. I can't provide direct services in my role, but I can certainly give you the guidance in terms of putting together a strong application or thinking about where resources might be in your community. And I generally mean that when I say you can reach out to me. And even though the program that I specifically represent, our focus is on individuals experiencing homelessness, that applies even if your loved one isn't experiencing homelessness. I'd be glad to just answer anyone's kind of general questions about it and, you know, kind of give you tips on how to navigate the process. I think just, again, I don't want to like beat a dead horse, but I really just encourage you all to know that the supports are out there in your communities. I think that it's just often not well known. There are just good intentioned people out there doing the work. And so if you just kind of need help, just like, I don't know where to start in terms of looking for those people, please feel free to reach out to me.
Thank you so much. You all have been just such incredible role models of how wonderful and supportive it can be to access unconventional methods of support. So thank you. We're so appreciative of Therese Rupert, Sarah Brown, Sumitra Polpato for sharing your professional expertise around utilizing unconventional mental health resources. Thank you to everyone who watched live or is watching this recording. We hope that this information empowers you and your loved ones and your family. If you would like to keep learning with us, please go to our website for Families for Depression Awareness, familyaware.org, and sign up for our newsletter. And you can follow the link on this screen or scan the QR code to fill out our survey. We really appreciate that as we can tailor our future panels to what you would like to learn the most about. So thank you so much again for joining us, and have a great day.